Mama Dr. Ganjavardhana. Mama psychology පිළිබඳව visiting lecturer කෙනෙක් ලංකාවේ universities වලට. ඒ වගේම තමයි NISD එතකොට ශ්‍රී ලංකා Foundation Institution එතකොට NIE එකේ ඒකෙත් visiting lecturer in counseling අපි එනවා. එතකොට මම medical officer of psychiatry in charge medical officer of psychiatry base hospital කිරිබත්ගොඩ වැඩ කරනවා. එතකොට මම psychiatry and psychotherapy පිළිබඳ post graduate එකක් කරලා දැන් අපි MD exam එකට සූදානම් වෙන ගමන් ඉන්නේ. අපි clinical counseling field supervisor කෙනෙක් හැටියට වැඩ කරනවා, internship trainer කෙනෙක් හැටියට වැඩ කරනවා ලංකාවේ universities වලට. අපිට හැමතැනින්ම එනවා. පේරාදෙනියෙන්, ජයවර්ධනපුරෙන්, සබරගමුවෙන්, එතකොට කැලණියෙන් අනිවාර්යයෙන්ම එනවා. එතකොට ළමයිට අපි clinical internship trainer කෙනෙක් හැටියට ඔයගොල්ලන්ට NICE දෙකේ field supervisor කෙනෙක් හැටියට අපි වැඩ කරනවා. එතකොට අවුරුදු කිහිපයක්ම අපි කිරිබත්ගොඩ hospital එකේ අපේ තියෙන වෙනම psychiatry and counseling unit එකක්. ඒක මට කලින් හිටපු ડોක්ටර් පටන්ගත්ත ડોක්ටර් කුමාරනායක. ඊපස්සේ ඒ unit එක අපි දිගටම කරගෙන යනවා. එතකොට අපිට තියෙනවා youth counseling unit එකක්. එතකොට youth counseling clinic එකක්. family counseling clinic එකක්. ඒ වගේම තමයි general psychiatry clinic එකක් ආදි වශයෙන් තියෙනවා. ඒ වගේම මම resource person කෙනෙක් හැටියට වැඩ කරනවා WHO එකට, Asia Foundation එකට, Plan International එකට, ඒ වගේ NGOs කිහිපයක් එක්ක වැඩ කරනවා අපි. තව ඉතින් consultant කෙනෙක් හැටියට වැඩ කරනවා NIE එකට. එතකොට ඔය මේ boys town කියලා තියෙනවා මේ youth rehabilitation center එකක් රාගම. ඒ විදිහට අපි ඒවත් ක්ලිනික් කරනවා. ඉතින් ඔයගොල්ලෝ හැමෝම අඳුන ගන්න ලැබිච්ච එකම this English medium. I'm very happy to conduct a lecture to you guys because when it comes to counseling, we have to always look at the subject from a practical aspect, right? From a clinical aspect. Because whatever the course that made you to start this diploma, whatever the course it is, at the end of the course you should be a competent counselor who can work with a client who is having all the capacities of having many counseling skills and also the theoretical knowledge to understand the client's problems, to define them, to come into a psychological diagnosis and plan the intervention, successfully carry out a counseling session and terminate it successfully, right, with a significant clinical result, right? So that's what we expect at the end of your training, including your internship training. So as internship trainer, as a field supervisor, what we understand is even not only with the trainees but also counselors in the field, the knowledge about biological basis of psychological problems is very, very lacking. There are a few reasons for that. Number one reason is usually, if somebody comes into this stream, like, psychology students, they do not have this biological basis, not in their advanced level studies and either in the, undergraduate studies also. There are subjects called, related to biopsychology, but unfortunately, those have been also conducted by lecturers or academics without a proper biological basis. So, making the subject interesting and making it understandable is always a little bit of a challenge. But however, wherever it is possible, we come out with this explanation to give you a very clear picture about what is biopsychology and why we should know about that. Right. I would, rather than, giving a letter by letter, word by word explanation or letting you to write down a note, I would like first you to listen about this today, right? You will be doing a lot of listening today. And after that, you will have the recording. I will let you, make the recording available and you can make your own note based on the recording. Understood? Right, great. Now, coming into fact, right? What is psychology? Why Does a counselor need to know about psychology? Forget about bio part. Why psychology is related? Why psychology is related? Now, coming into the realistic picture, right? When if you are a counselor, definitely a client or someone will come to you, walk into you with a problem. So, fortunately, that problem will be it will it be a physical problem or will it be a mental problem or something related to the mental health, isn't it? If it was a physical problem, he would definitely go to a physician, go to a hospital. But since it is a psychological problem or a problem related to the mental health, definitely they will be coming to you. So these people are having problems in their mind, isn't it? With their mental health, it's a psychological problem. So a person with coming with a psychological problem, right? To understand the problem, to define it, you will need this knowledge in psychology, right? So for an example, the person will come to you telling that I'm having a very disturbed sleep for last few months. So to find out the causes and to define the problem, or to identify that this is anxiety, or to identify this is depression, and plan your intervention accordingly, you have to know definitely how to you know uh, get the problem out, clear the problem out, right? Come and formulate a psychological diagnosis. So to do that, you need knowledge in psychology. So each and every problem, right? Each and every problem can be defined in mainly in three ways, right? We can use three dimensions, right? I will try to use the whiteboard if it is possible. It's a little bit difficult to me while using the PowerPoint presentation. One second. I'm not a bit fan of PowerPoint presentations. It's not right, but wait, I will try the other way around. So if you have any problems, please raise your hand, right? Since I'm a visiting lecturer, you should not hesitate to question me at any time. There are no any impact, right? Any bad impact. So we will be meeting very rarely, so you can ask anything from me, right? Because I need you to understand the topic very well. Harida. That's the most important thing, right? When it comes to problem, right? The client comes with you. Can you see my screen? Can someone talk? Can you see my screen?
Yes, sir.
Ah, good. Okay, right. Ignore the notifications, right? Ignore the notifications since I'm sharing my screen. So always people will come to you with a problem. Fortunately, it will be a psychological problem, right? Or a problem related to the mental health. It will be a mental health problem, right? It will be a mental health problem, hopefully, right? Why I'm telling hopefully, why I'm telling hopefully. Now, sometimes the people will come to you, if you are a well-known counselor, people will come to you with this, like the same example. If I take, I cannot sleep. I'm having a very disturbed sleep. It could be a medical problem also. And the counselor should be skillful enough to elicit or to think about, to suspect about a medical cause, and also to, if it is needed, to refer the client to a doctor. Right? That's why referring to a psychiatrist is always advisable, because the psychiatrist is the person who's having the knowledge both medically and psychologically, also in the sense of psychiatry, right? What's the difference of psychology and psychiatry? I will explain you in another lecture. So it's always good for you, always keep this in mind, to refer to get an opinion of a psychiatrist, right? That's always good, because it's very easy then if to elicit the medical causes. Because when you come into the clinical practice, right, your counseling must be successful. Your counseling must be fruitful. It should be effectful. Your counseling should be enjoyable, and people should be appreciating it. Only then you will become a good counselor. Sometimes it's not just only the result, right? I have been, sharing some videos about clinical counseling. In it, these are bilingual. I will share the videos with you also. Someone can WhatsApp me. I will send you your WhatsApp number. Then you can share within your groups. So you should always, from the beginning of your course. Now, how long you have, following this course? How many weeks or months? Can someone answer me, please? කොච්චර කාලෙද?
About 4 months.
4 months, Ante. So you are almost halfway. So now you should, orient yourself, right, with the clinical scenarios, right? Now the theory should be converted into, practical applications. You should always ask the question in the practice how this will be useful in the practice. හැමතිස්සෙම practice එක you have to think about, you have to imagine yourself with a client seated, and you are, investigating a problem and finding a solution. Right. So we will come back to the topic. It will be a mental health problem. So this mental health problem should be defined, appropriately. There are several ways that people define mental health problems, and there are several ways. Number one, yes, it's the psychological definition. For an example, this person who's coming to you complaining of disturbed sleep. So you inquire the person, you get the clinical history, and you got to know that this person's wife had passed away 3 months back, which was, they were living together, they were sleeping together, and, he's developing depressive symptoms. Initially, it was just grief symptoms. Then the grief developed into, adjustment disorder symptoms. And after that, now gradually the client is developing depressive symptoms. So you must know all three: what is grief, what is adjustive disorder, and what is depression. You should know very clearly what is depression. And hopefully what happens is, then you find it out that this person is having this psychomotor agitation, a clinical symptom of depression. And due to this agitation, he is anxious, he's having worried thoughts, even sometimes suicidal thoughts. He's losing the value of his life. Without the wife, I'm all alone. And he cannot sleep. There are so many thoughts coming to his head. Then the counselor will identify, yes, these depressive symptoms. This patient is depressed, anxious, agitated. So I would plan my intervention accordingly. I will start with simple relaxation techniques. I will start with simple relaxation, and after that I will try to give psychoeducation to him in my subsequent sessions. And my main therapeutic intervention will be mindfulness based psychotherapy, or my main stream of intervention will be insight oriented psychotherapy or interpersonal therapy, whatever it is. So you should, you define the problem, you identify the problem as depression with the help of psychological knowledge. There's another knowledge, it's called the biological knowledge. It's a biological knowledge. What's the biological knowledge? After the death, separation of the wife, this person, had very difficult situations at home, where the wife was cooking for him. Now he has to cook alone, and he's not he does not know how to cook well. He's having difficulties, hard times in the kitchen preparing food. He cannot even prepare himself a good cup of tea. Both the children are overseas, migrated. He does not have anyone in the vicinity, no relationship. So little by little, there started negative inputs to his brain. And, the neurochemical for happiness, initially mainly serotonin, is drying out. Little by little, serotonin is drying out. So he does not have positive impulses. So when the neurochemical serotonin is reducing little by little, what happens is he is developing a depression. So this is the biological basis. So what should I do? I should, design activities, related positive activities, with the intention of increasing his serotonin level. So I will advise my client to have a pet at home, a good, a little bit of a high, good breed, intelligent puppy, like a German Shepherd or something which the client can, afford, or a good, kind-hearted, very, also very, cute puppy we can choose, depending on the client's, um, desires. We can choose a puppy. So you should know, every counselor should know, have a slight knowledge about puppies, kinds of dogs that can be used in therapies. Pets are very often we use in therapies, right? In cats also there are several, various kinds of cats. The Persian cat, if you can afford, it's a very, a little bit intelligent cat that we use in therapies. There are birds that we use in therapies, right? Especially, people with, when people are alone, we use lovebirds. We use parrots when people are alone, right? There are few other factors that we can use birds as, therapeutic, models that we can use. So it's a huge area, guys. Just I want you to show the limits of, counseling interventions. So there's a biological explanation. So the most important thing of understanding this biological explanation is to, you can understand the severity of the illness. You can grade the severity of the illness, and after that you can refer for a biological treatment. Right. So these are chemicals. I will, in the lecture, I will explain you what are the chemicals. So these are chemicals in our brain that creates electricity. Electricity. So it's like a, pin torch battery, right? In the battery, how we get the electricity inside the battery, we get it through chemical reactions. Same, concept works with the brain. The brain is having biological, chemical, we call them as neurotransmitters. So these neurotransmitters generates impulses, electric impulses. So there's a very complicated circuit, neuronal circuit in the brain. About 3 billion neurons are there. You have inside your head, just in a 1.5 kilograms your brain is weight. So you're having billions. The neuronal connections are counted in trillions. So it's a very complicated, the most complicated, creation of mother nature that you ever see. It's complicated than the total universe. We cannot understand the universe, as well as we cannot understand the activity, the connections of the human brain. We are still studying. We know almost all other organs in the human body except for the human brain. Still we are learning, right? Still we are learning. For an example, we know the right side of the body is controlled by the left part, and the left side of the body is controlled in the right part. But in strokes, when you get a blood clot and the blood supply for the another part of the brain is completely shut down, we expect, the other side to be paralyzed. For an example, if your left side of the brain is, shut down, the blood clot, usually the right side is paralyzed. But we have seen in clients, the other side of the brain, the right side of the brain takes over the function. Give me, I will work with the right side also, although I'm used to work with the left side. So it's an incredible, incredible creation. It's a very miracle. So how can we explain this brain, the behavior of the brain? We a little bit know about its biological basis right now. We are investigating, we are having researchers, there are neuroscientists, there are psychiatrists, there are neurophysiologists, there are neurologists, clinical neurologists. Everyone are, just working out with this brain. We have new methods to investigate the brain. Something like, you heard about MRI? We have functional MRIs. Functional MRIs are really helpful to us to understand the brain. I will send some videos so you can understand how these, brains, how our human brain is being investigated, right? Even at the end of the lecture, I will explain you with some, diagrams. So there's an electricity. Even in a circuit, you can have a short circuit. With a short circuit, your electrical equipment will malfunction. The same concept in the brain also. The brain can have, short circuits. These short circuits can be genetically determined and also it can be artificially created after the birth due to the external factors. For an example, cannabis creates short circuits. Methamphetamine abuse creates short circuits. Right? Continuous negative impulses, continuous negative stress creates short circuits and your brain starts to malfunction. So this is a biological explanation to the human problem. For an example, dementia. Dementia can be explained only biologically, not psychologically. Learning difficulties, congenital defects, congenital problems in the brain can be explained only biologically, not psychologically. Understood? So you have to, everyone should have a clear understanding about how the human brain works. There are other explanations also. This is not related to today's topic, but it's better, it's worth to you to know. There are other explanations for mental health problems, which you should be sensitive of, which you should be aware of. We call parapsychological explanations. So they are not scientific. Some are told superstitious, some are beliefs. For an example, you are cursed. There is an unseen force working on you. Your dead mother is talking to you, so you have to do merits and send the dead mother away, or you have to create a connection with the dead mother and you have to listen to the dead mother. You know what you have, why this illness, continuous illness, why are you having this headache? Somebody had done a hoodoo on you. Punya, a hoodoo on you. Or it can be explained in, these horoscopes. It's also a, kind of a science, right? We should never, neglect these things. These are social in our culture. These are social aspects. We should be very sensitive to those. And we should sometimes, we can even utilize them as therapeutic techniques. For an example, they will come, a couple will come to you telling that, the husband will tell me, Balandako, Miss Miami, he had an extramarital affair recently. I got to know that that person has given something to her, ingested something to her, so that thing is working inside her. So that's why she couldn't control herself and she went to him. So the person is having a parapsychological explanation for the wife's extramarital affair, right? And wife, after getting caught, needs understand that this is not good. I'm not in a situation to continue this extramarital affair. Then now I have to come back to the family. And it's a great window to the wife to come back to the family. Can you balandako? This person has given me, ingested me. That's why I could not have control myself. Now we went to a kattadia, and he gave this thing, Vadavireka una, and it left something fallen even to the, to the Scottish pan. I even heard the sound. So it gives a clear picture, it gives an explanation, and ultimately they can come out of the situation. So as therapists, we should use the situation. Yes, then that's very good that you are having such a, explanation for the problem. Okay, now we will work with how to strengthen our family. What are the issues that we are having in the family? So we can start the therapy from there. See how easy when you're sensitive to this cultural stuff, not to just reject them blindly, right? We still never know whether they are true or false. We cannot, 100% say that they are false. Even the horoscope, can someone say that 100% they are false? You may be wrong in your horoscope reading, but still, why people are still believing on those? Mekai, this is you have this Erashtakya, this nature vela, this grahaya, that grahaya ucha vela, that's the problem. Now you have to do this. They say therapeutic interventions too. Go to a temple, bodhi puja hataktiyana. So they will be having some relaxing time. They will be having time in the, in the temple, right? People will be doing, paying attention to the problem. There will be Sura kept for phobic anxieties. It's very effectful. There will be Nol Maturala, Dehi Kapala. This intervention, guys. So never, disrespect, disregard the positive. There are the both sides, guys. But I'm talking about the positive side. Negative side, yes. Negative side, always we will neglect the negative side. We will disregard the negative impacts. We will correct the negative impacts. But at the same time, we have to consider the positive impacts also. We should not, when it is useful, wherever it is useful,
we should not hesitate to utilize that in our therapy. Just be open-minded. That's what I expect from you guys. Because we see like people just knowing few words about counseling and knowing few knowledge about psychology, just very 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 unhealthy way, in an unethical way they criticize these things. But there are for many positive things. Before counseling it's been introduced to Sri Lanka, right? It's a very young discipline, counseling. People are still adapting to these things. So all these years, most of the psychological problems, mental health problems are solved in this way, in this culture. So before psychology come to Sri Lanka, they have a Kattaliyas, they have a Devalas, they have a Sastras, they have a, I don't know, all the horoscope readings. So never disregard, respect your past. With the sake of the science, don't just, throw these things away. We can utilize whenever possible, right? And also there are some psychological disorders are not treated due to these explanations. So in that way, then and there we should rectify, right, that wrong knowledge. Then and there we should attend to such problems, right? Maybe directly, indirectly we have to get involved in these things. That's a separate story. I just wanted to tell you that when you get a psychological problem or a problem related to mental health, you can define that problem biologically, psychologically, and what we just talk about parapsychological. Okay, good, great. I thought I'll be young with today's our lecture. We'll proceed with our lecture. Wait, send a copy. Are you understanding? Is my speech is understandable to you guys? Tell me if you haven't understand, please. You have to speak openly. Mention you can in the chat box. You can give a direct message. Somehow you have paid for this lecture, and I am being paid for this lecture. Your payments. Okay, good. Biologically, right? There's a problem throughout the ancient eras, right? The ancient psychologists are. There was a huge debate. What is this debate is all about? About what is the brain? What is the mind? Right? What is the brain and what is the mind? The mind and brain problem, they call it. The mind and brain problem. So some say both are the same, right? Both are the same. So it's called monism. Don't forget about the word or dualism. Some say no, these are two things. What do you think? In Sinhala we call Molaya Saha Manasa. What relationship do you have? What answers do you have, children? Kiyanna බලන්න. මම මෙතන like ඒකාංගික නළුවා, I'm just speaking. I just want your feedbacks also. Just we are just good friends, colleagues. Tell me, you will be in the field after few months, so we will be colleagues. Tell me, what do you think? What is the relationship? Speak, talk. Anyone? We have 22 in the list. I don't like to name anyone, right? Otherwise, it's been boring. I will fall asleep if you are silent. I'm usually, I'm lecturing most of the time in my, daily routine. I'm conducting lectures, so it's like now driving to me. When you're used to drive, your brain is been, perfectly wired, and you fall asleep if you are a good driver. Yes, since your brain takes, okay, I will take over, you have a nap. Unfortunately, the brain cannot take over everything. When we sleep, our higher cognitive functions, they stop, they decline. And after that, we don't know, we stop seeing things. So tell me, similar to me, lecturing, if you are not talking, I will fall asleep. So please, don't keep me in a very difficult situation without answering. The lecture will be boring to me, not you. Tell me, guys, what do you think? What's the connection between the mind and the brain? In single English, Tamil, any language, I can understand all three. Solungada. Tell me. Hey Shani, hey Shani. Subhashini, yes, please.
So brain that we can think, we can memorize, and we can analyze all those things we can done by our brain.
Okay.
In mind, that it can't think, it can't analyze.
Okay. Okay,
Just
understood.
think.
Is it something connected with the soul, Subhashini, the mind?
Yes, that we don't know where is our mind.
We
That's the
don't know. Great. Okay, great.
That's
Thank you.
our,
That's another problem. Where's the mind? That's another problem. Good. Thank you. Any other, you don't have wrong answers, right? So anyone can, everyone are invited, open to speak. There are no wrong answers. In psychology, there are no wrong answers. Yes, Umeesha?
Mind can travel anywhere it wants.
Okay.
So the brain is a physical thing, but
Mind is something.
We can't
Mind is
see, we
something
can't touch
spiritual.
it.
Is it something
Yeah,
spiritual?
we don't know where it is.
We don't know. It's very, gloom. We don't have a clear picture about what is mind. Good, very good. Thank you. Thank you. Someone else? Fatima Hafsa? You have a nice pendant. Fatima? Speak. Who are not actively in the lecture. Wasima? So no one is in the lecture. So I will chase you out from the lecture. I need something. I need to know. Any boys in the team? No boys, only girls. Only girls. I can see. Janusia. Janusia, I know you are a girl. Tell me. I want someone to speak. I want to know this cultural influences in yours to understand what is mind and what is brain. Kata karana. Otherwise, I will be chasing out from the. Yes. Thank you, Wasima. Thank you.
Sir, brain is a organ or part in our body. It is
Okay.
connected with the like nervous system and everything.
Okay. Great. Great. I agree. Okay.
Mind is something. It's like a functioning of the brain.
Oh, great. Exactly. Very good.
It's like a process, like
Like
a process of the brain. Like.
Oh, great. Exactly. Thank you very much. Thank you very much, Prasid.
Thank you, sir.
Really appreciate. Really appreciate. Now, guys, listen. Today onwards, you will be very clearly answering this question. What is the human brain, right? So you can answer this question with your biological knowledge that you will get in this lecture. Your brain is the main functional unit of your nervous system. You just think yourself, what will happen to the mind if the brain dies? Will it exist or will it vanish or discontinue? What do you think?
It's discontinuous.
Yes, it will not exist. Right? So then we can find there's a very clear relationship between the mind and the brain. For an example, in a brain death, that if a person met with an accident, there is an internal bleeding into the brain and the brain dies. If the brain dies, unfortunately, the person dies. Even the person's heart will be functioning, the lungs will be functioning in the ventilating machine, but still the person won't react. Why is that? The brain has death. So, what is mind? It's the functional experience of the brain. It's better if you can even write it down even at this instance. Mind is the product the functional experience of the brain. So what is brain is the main functional unit of the mind, of the nervous system. Brain is the main functional unit of the nervous system. So what makes you a living being, what makes you a living thing is your nervous system. Even the single, what you call the single cell organism is also having small elements of a nervous system. The amoeba, for an example, is having the teeny weeny elements of a nervous system. The most basic primary thing. It's reactive to the external environment. Amoeba, just one cell. It's walking in search of food. Amoeba, yes. So what makes us living is our nervous system makes us a living thing. So what's the most developed part of the nervous system? Element of the nervous system is the human brain. The most developed, the most complicated, complex product of civilization, of evolution, not civilization, evolution. The peak of the evolution as a whole is the human brain, guys. There's nothing more complicated than the human brain. Understand? There's nothing more complex than the human brain. That the human brain has empowered the human being throughout the years, making the human the most powerful, the most dominating living creature walking on earth. The man was able to conquer from Arctica to Antarctica, all the continents, even in the deep sea up to the outer space, due to this human brain. What a magnificent masterpiece of Mother Nature. So this makes us, the product of such a complicated structure should be definitely complicated. So do the human mind. So does the human mind. So that's why we cannot even give a clear definition for the human mind. We can give a religious definition like you can give us some kind of another cultural definition like the soul goes to one body and to another. You can give many other definitions. But it's still, whatever the definition you give, the mind is the functional experience of the human brain. Understood? Terunada, guys? Understood?
Yes, sir, understood.
Yes,
Thank
sir.
you. Thank you. Now, let's talk about this nervous system, this magnificent nervous system. What makes us so powerful and so complicated? Right? That's why we fall in love in our early stages, and by our external experiences, our love changes. Most kind of school loves will stop when you are doing your higher education. In your higher education, we'll have a separate definition for the word love. And after the education, when you walk into your professional life, you will have a separate definition of love. You will find a separate person to love. And even after that, also when you're coming into middle ages, again, you will have a separate definition for love and you will be lacking love. Why this complexity? It's because the human mind is so complex. So what makes the human mind complex is this nervous system. So there are two parts of the nervous system. One is the central part, the main part, and the peripheral part. The peripheral part helps us. It's the more primary part. It helps us to, function as living beings. Even they are in the teeny weeny insects. Also. Even you get the cockroach is also having this the elementary nervous system. But we are here. We need elementary nervous system also to, especially to recognize, to understand the human responses to, triggering factors like threats, how our body and our mind is responding. For that, we need this peripheral nervous system. But our main concern today will be our central nervous system, which fortunately consists of the major part, the brain. So this is the central nervous system. Here inside your skull, you can just step and see whether it is empty or not. What is the sound coming out of inside your skull. You can just tap a little bit hard. Yes, you can see. It's like, the wormy structure, the human brain. It's not a new thing to you. And this yellow color thing is called the spinal cord, which extends from the brain and runs down your spine, along your back, towards your lumbar region, along the back towards the butt, I say usually. Good. So what's the basic element? The building block of the nervous system is the nerve cell. The nerve cell, it shows the basic function of the total nervous system, the nervous cell. It displays it. It stands, the neuron cell. So what does it do is it collects stimulus from the external environment or from the internal environment. It could be, in your senses, it could be something from the external environment. Inside your brain, it's a message from the neighboring cell. So it collects information, processes the information, and submits the information to the next cell. It collects information, processes it, sorts it, and it transmits the impulse further. So that's the basic concept of the nervous cell. So there are several types of neurons. This could be too much. No need to look at this. So this is how we see, right, the true picture of a nerve cell. So this is, result of new technology, right? These are not just theories. These are reality. These are practical things. That's why biological explanations are a little bit more efficient than psychological explanations at some instances, because we can see, we can have researchers, we can have assessments, we can explore, we can understand through scientific techniques. So this is the true nervous cell, how it's been really visible, the true form of a nervous cell. You can see this, like, the like this root thing, like the branches, they collect information from the periphery. And the middle thing, in the center, you can see the cell body, we call it the cell body. So they process the information, sum up it, and process one signal further. So only one signal is going further, right? So this is the structure of the neuron. Right? This is how the neuronal impulse, the electric signal, is being transmitted further. The electric impulse is being transmitted further. Can you see? Splendid, right? So you can see these dendrites. You can see the small, like the branch-like structures. The dendrite, they absorb, they receive information from the peripheral, again, from the neighboring cells, and it's been sent to the cell body. There are chemical changes are happening dependent on that electrical impulse, especially in the cell nucleus. And neurotransmitters are being created, generated, and the signal, the electrical signal, the neuronal impulse we see is transmitted through which called the structure called axon. Digadandak, right? Just get the concept, right? I won't be keeping a question in the exam, explain the neuronal cell, no need. Just the axon, the impulse is going, and it's being distributed. The signal is being distributed through the axon terminals. Distributed. You can just read if you are interested about the neuronal cell. But the neurology, if you are interested, you can just go through this slide also, get some additional information. And this is how it's been happening. How this electrical impulse is being transmitted. It's due to, exchange of ions, sodium and potassium exchange, the ions exchange, and you get what we call action potential. You get a small electrical impulse. So that impulse is transmitted further, like this, the depolarization, how just it occurs, how just the current occurs, right? Podi impulse. So it's, although I call it podi, right? If you get all the electrical activity of the brain into one single circuit, you can light a 80 watt bulb for 3 hours. So that's a considerable amount of electrical energy. That's why you have seen even in ancient stories, you have seen this some humans who are having this excessive electrical activity, who we call superhumans, right? You can see the electrical activity from the head. You have seen the third eye, this having this glittering area, a very bright aura, they say, right? The rest hidden out from the head. It's due to this electrical activity. It could be. I'm not sure. It could be, right? So this is how the neuronal impulse is being created and generated. You can just go through the slides. I will leave this presentation with you. And this is the way how it's being transmitted. So there are ways. The neuron itself, how quickly they transmit it, about 120 meters per second, how fast the electrical signal is being transmitted. So even in your feet, if you prick something into your feet, very suddenly the signal goes to your brain, and by the brain will instruct to you to take the leg off. It happens so quickly when we are not aware about it. We are taking the leg off. Only after that we will check what did prick, what did hit us. It's so quick. The neuronal activities are very quick. And there are multiple connections all over the brain, multiple areas in the brain. Some areas are having memories, some areas are having emotions, some areas are having visions, experiences, definition. So there are some areas defined, there are some areas related to your speech. Ammo, Anuna, I got hurt, my God. So everything is interconnected. So complex, so quick. That's us, yes, they are humans. And how do you control this? How this is not a blind circuit. We can change the way we think. We can change the way we behave. We have separate thoughts. Our thoughts are, some days our mood is very high, some days our moods are very low. So these electrical impulses are being regulated. There's a relay. If you're having a small understanding about electricity or electrical knowledge, the terminology called relay. So there's a switch. There are switches in the brain, multiple switches. So these switches are called synapses. So they regulate the signal. They can moderate the signal. They can either increase, either they can decrease, or they can alter. That's why we can, think differently. In the beginning, like this lecture was like boring. Now it's like, it's like a little bit incoming. It's interesting. Or in the beginning, it was interesting. Now it's like getting complicated. I don't know this biology. I hated biology. Even that's why I didn't do biology. That's why I did arts. Why they are teaching us biology again? Understood. So our brain is, having multiple thoughts, different, various thoughts, huge variety. It's caused by these synapses. The signal is being transmitted into the electrical signal, is being transmitted into a chemical signal. So there are neurotransmitters, small vesicles, like small teeny weeny chemical things are being stored in the axon terminals. Can you remember that in that neuronal cell that I showed how they distribute? So that electrical impulse is transmitted into a chemical impulse, and it's been regulated by receptors and neurochemicals. Receptors and neurochemicals. This chemical will go, and you can see like this, bean seeds. You can see these are receptors. So the chemicals are like these captings, like small, teeny chemicals. They bind into the receptor, and the receptor then again generates an electrical impulse. How they regulate this is they can increase the receptors or they can decrease the receptors. We can upregulate or downregulate. They can increase the neurochemicals or they can decrease the neurochemicals. For an example, if you are given a very delicious food for you, you keep on eating since it's very delicious. But while you're keeping on eating, when your belly is being filled, what happened to that deliciousness? It will decrease, it will diminish. You decide what will happen to your desire to eat. Once your stomach has been gradually filled up, your brain is sending signals, now enough. To stop us, what does the brain does? It reduces the desire. Now enough, idiot, stop eating. Stomach is filled. Ayyo, yeah, this is enough to me. I'm filled. I'm done. Speak it out. Tell ati matepa. Pada pirila. Speak it out, idiot. Speak it out. Otherwise, you will vomit yourself, idiot. The brain starts to regulate you, to control you. You will see a handsome boy walking towards you. You're getting anxious. Is he going to talk to me? The brain is telling, idiot, you are in front of a lecture, your lecturer is there. Look down, look down, look down. People will think bad about you. The brain regulates us. These signals have been regulated. We have been controlled. We think that we are masters of our mind. No, our master is the mind itself. We do what it says. Just think after the lecture, what am I speaking of? So inside the brain, there are switches, the relays to control. And fortunately, we can modulate this chemically. That's why we have drugs, medical medicines. So in depression, for an example, right? In depression, we have less amount of serotonin, a neurotransmitter, a chemical. So we can artificially give medications and increase serotonin levels. So the client will have disappearing his or her depressive symptoms. But also by psychological treatment, which you are going to do for depressive patients, you can increase positive activities to the client. Can increase positive activities. By those positive activities, you can increase the chemical levels. You can change the atmosphere of the client. You can change the environment of the client. That was the true cause for the depression. Because it was the environment made the serotonin reduce. So the medications can temporarily increase the serotonin level. And it can maintain the serotonin level. But to cure the client, to cure the patient, what you should do is you should change the environment by psychological therapies. That's why counseling is so important in Sri Lanka. That's why important. Sometimes we need go for medications, and sometimes when there are severe disorders like schizophrenia, like bipolar affective disorder, like dementia, which we cannot correct by psychological terms, by psychological intervention solely alone. So then we will need definitely medications, otherwise we cannot cure the client. So excessive dopamine activity in the human brain will cause psychosis. So definitely you have to go for medical treatment to reduce that chemical, to control it. In bipolar affective disorder, you need a type of drug, a class of drugs called mood stabilizers. Otherwise, this chemical will be, these chemicals will lose its balance. So definitely people with bipolar affective disorder will have to be on a mood stabilizer. Sometimes lifelong, it's no problem. It's like patients are having chemical imbalances in their heart. We call hypertension. We give them treatment. The treatment for hypertension is lifelong. When they're having problems in their chemical called glucose, we call it diabetes. So the medical treatment is lifelong for diabetes. Similar concept applying psychiatric disorders, illnesses. It can be, it's not something, disastrous. It's something, very normal, physiological. So don't be scared of medications. It will help you as counselors. You should correct your perception regarding medications. Medications are helpful for your theory, for your therapy. You need to work with a doctor for this sake. You should liaise with a doctor. You should have a good relationship with a psychiatrist to manage your clients, guys. Right up young isarada. So these are so one single cell will be receiving multiple signals, but it will be sorted, regulated, and being transmitted. You can go through just some pictorial elaborations about what did I just speak about.
මේක තමයි how these neurotransmitters are released into the synapse space and they are received by the receptors. And the signal is being regulated or modulated, anything you can use. So it's this concept is like, the key is like the neurochemical and the receptor is like the, the lock. So lock and key action. The chemical goes and fits perfectly to its appropriate receptor to generate the appropriate signal. So when you get sad, negative inputs, your internal brain reactions will be wired negatively. You will not listen a praise. Everyone will be telling you are a loser, you are a weak, you will be getting negative inputs and your brain will be wired appropriately according. Pathetic name. So what are the neurochemicals? You should know these neurochemicals by name. You should by heart this, right? You should by heart this, the table, right? Acetylcholine, right? It's for the learning and memory and also muscle activity. Acetylcholine. And when we are having problems with acetylcholine, the neurotransmitter, you can get dementia like Alzheimer's disease, Alzheimer's. Dopamine, yes, it's essential in attention, emotion learning. Dopamine, yes, and also movement, fine movement. With problems in dopamine, you can get, if Parkinson. If less dopamine, Parkinson. Excessive dopamine, schizophrenia. Serotonin, as I told you, sleep, mood, arousal, attention. So low serotonin, depression. High serotonin may be bipolar. Norepinephrine, again, its function about to control alertness. If you're feeling asleep, you're having low levels of norepinephrine. Right? Right. Norepinephrine is related to your mood. So less amount of norepinephrine in your brain, it will cause depression. GABA is inhibitory. GABA helps us to control our pain, our mood, helps us to control. If you're having problems in GABA, we can even cause seizures. We will be having problems in our sleep because it's like settling us. GABA is settling us. Glutamate, it excites us. Glutamate excites us. It excites us. Come on, you can do it. Come on. It's very essential even in memory also. These are the neurotransmitters and their functions. This is about the spinal cord. There's nothing, serious about the spinal cord, nothing important, but you should know the basic concept and the function of the spinal cord. It collects neurological impulses from the other parts of the body. It collects and it transmits to the brain to process. And the reply is being sent back through the same spinal cord to the relevant muscles to respond to the environment. And also we can react at the spinal level also. When you suddenly touch something burning, when it hurts, your hand is being, straight away taken away from the burning object. You can't wait till your brain to judge. It's your spinal cord that takes your hand away, preventing you from further damage, further burn. These are the reflexes we have at the spinal level. We call it spinal reflexes. Spinal reflexes. The reflex arc, right? So this is the magnificent human brain that we were talking. There are areas in the human brain, right? The first is we call the forebrain, the hindbrain, the midbrain, and the forebrain. We also call it primary, secondary, and tertiary. Hindbrain, midbrain, and the forebrain. We call it primary, secondary, and tertiary. There are three parts of the human brain. There are three parts of the human brain. This is the brain stem and the cerebellum. They stands for our basic human functions. The brain stem, breathing, heartbeat, coordination, muscle movement, cerebellum again, coordination, muscle movements, breathing, heartbeat to keep us alive. So the nervous system is what keeps us alive. Digestion, breathing, the basic functions. That's why it's called the primary brain. Hindbrain is the primary brain. ඒකේ තියෙන pons medulla මේවා නිකන් දැනගෙන තියාගන්න. Just read this. It's nothing much serious here, right? Just go through the primitive part of the brain. Then we have this, we get into this primitive part of the brain is always connected with the upper part, the above, the next level. So this reticular formation lies in between, it's in the margin, it's like the processor. It, it's like a server, it's like a coordinator, the reticular formation. So it activates the upper part of the brain depending on the information from our lower part of the brain. So this reticular information system is related to the arousal system. When a person is more aroused, more disturbed, more aggressive, this reticular formation is, activated. It's responsible. For an example, when you are angry, your heart starts to beat fast, isn't it? When you're angry, your breathing rate increases. You will start breathing rapidly. Right? When you're angry, your blood vessels dilate. There are flushes. Right? I'm burning inside because your blood vessels, they expand and the heat is being transmitted and you will be felt the heat inside the body. So this is another aspect, especially, in some disorders like anxiety, you have overactivation of the reticular system, reticular formation. Thank you. Right. Cerebellum is for muscle coordination. For the sake of the subject. Biopsychology. So when you are drunken, alcohol hits the cerebellum and it destroys the function. And after that, you can see, the drunken walk. You can see drunken people. They don't have coordination. So that's why they say don't drink and drive. You lose the coordination. You can't brake properly, appropriately. You lose the coordination between the brakes and the clutch and your steering wheel. So that's why you should not be, drunk a lot. Even a slight few sips of any spirit can influence your coordination. The cerebellum. In Sinhala, it's called Kudamoli. When it comes to the midbrain, we call it the mammalian brain. We call it the emotional brain. So it's the emotional part of our brain. So our next basic instincts are lies there. Love, anger, hate, trust, distrust, disgust, everything. The emotions are there. Emotions parts. So, love is a basic emotion that we have. It's a basic need of any living thing. And doctor, what's the meaning of that? Does ants or cockroaches love each other? They don't have that sort of a complex nervous system to define the love. But they do make love. What is love, guys, biologically? Love biologically is the medium for reproduction. Yes, reproduction is one of the primary needs of any living thing. Reproduce yourself before you get destroyed. That's the basic universal concept in every living thing on earth. Reproduce yourself before you get destroyed. So, how to do that? How to make it essential? How to make it definite? Love gives the taste of reproduction. If making love or having sex wasn't so
pleasurable. We won't be having it so much. We won't be reproducing us so much. Since the human brain is so complicated, it gives this fascinating sensation of being loved. It makes us reproduce more and more to give children, to produce children, to have sex. When every other animal, while having a season for offspring, a season to have sexual contact with their partners, only humans are having limitless capacities of having sex. Even it's not been regulated by even the menstrual cycle. People can have sex almost every day. So our sexual capacity is unlimited. It's due to the complex brain. So be thankful to your brain. It masks your need, urge of reproduction, and it gives you the nice definition. It gives you the nice explanation to reproduce called love. I'm love with him. Biologically speaking, I want to have sex, and I want to reproduce my siblings with him. I want to mate with him. I want to have children with him. So, literally speaking, I love him. Biologically speaking, I want to mate with him. Right, guys? That's the bitter truth, but that's the reality. Whether we say premenam sandeliya say akintai premenam confined to sexual act. Right, good. So this is the other part of the brain, the upper part of the brain, the more organized part of the brain. Right? It's mainly the cerebral cortex. You can forget about the other systems, not to make things complicated. It's just diploma in counseling. It's not a university, biopsychology session. So forget about the thalamus. You can even read about this. No harm, guys. No harm by knowing these things. No harm. No harm. Hypothalamus, no harm. Just you can read, especially the limbic system. You can read about this. So, no adult education. All of you are adults. Don't expect like A-level class. The lecturer comes, dictates, okay, you have written, copied it down. Okay, the lesson is done. No. You are adults now. You don't have lecturers. You have moderators. You have facilitators. So I'm showing you the areas. If you are interested, please. Gaining information is, it's dependent on you. We just show you the limits. We just show you the paths. We just open you the windows, the opportunities. If you are interested, please read and be knowledgeable. When you are knowledgeable, you are powerful. It will empower you. It will increase your self-esteem. Right? Okay, good. I'm moving without a break, guys. Is it boring? You can, since we are doing this online, you can even listening to the lecture. You can go to your washroom and come. Yeah, you can eat this thing and read. So I don't think that you need a separate, break. Is it? Do you need a separate break? Are you that old? I'm the one who needs a break, speaking continuously. Do you need a break? Someone answer. All are sleeping. Shall I continue?
Normally we get a break, sir.
Is this a normal lecture that you are having? Is this a normal lecture you are having?
Break, sir.
Huh?
Better to have a break, sir.
Oh, Hana, shit. I'm not going to do lectures again. Okay. You can have a break then. 5 minutes. 5 minutes on 5 minutes. I will give you 3 minutes. 3 minutes. Okay, we will continue then. I don't like long lectures, guys. It's very boring lectures, isn't it?
Huh. Shall I proceed then?
Okay, sir.
Shall I proceed? Shall I proceed, guys? I didn't hear you. Sorry. Yes. Okay. Thank you. We will proceed then. Right. Now, hypothalamus, the limbic system. You can read, right? When it comes to the brain, there are several areas, specific areas. They have a good coordination, a good management in the brain, right? So you can even go through these. Just I want you to understand that the brain is having specific functions in specific areas, and they have very fine coordination between these areas. For an example, if I take frontal lobe, it's the boss, right? It's the like what can I say? It's the super ego of yours. It's the what we truly call brainy is about the frontal lobe. So, all the executive functions is being done there. If you come to the temporal lobe, you have for the language, there is an area for language also. Understand the language because it's near your ear. So you're understanding the sounds, words, right? And also, it's about hearing and some parts of emotional control also. Because when you hear, emotions are being generated and you need a brain area very adjacent to that to gain some control. The back of your head, the occipital lobe, it's related to vision. Even when you're having problems in your vision, you get headache back of your head. So you have the center and the motor cortex. The motor means all your motor movements are being coordinated, regulated there. It's the most highest function, motor cortex. And the sensory cortex, the sensation you get from all over your body, all the information is sent here and being regulated. Right, guys? That's your precious brain. It has two parts, the right brain and the left brain. So you can have a dominant brain, dominant hemisphere, and a non-dominant hemisphere. If you're right-handed, your dominant hemisphere is left. Usually all the body parts of yours, the left one is a little bit larger than the right one, isn't it? Females, males, both of you can understand what am I talking about. So if your left side of your brain is dominant, it takes up all the hard work, while the leisure things is being handed over to the non-dominant part of the brain. Non-dominant part of the brain. See, you can see a little bit large here. The left part is a little bit large. Can you see? So it starts from the brain itself. From top to bottom, it's the same. Okay. Hope you will understand what am I talking about. So the non-dominant brain, the right side, non-dominant, it's non-verbal, images, music, enthusiasm, more the sexual part. When you're leisurely doing things, serious things are done in the dominant part. So his brain has, that's why we call about split personalities. For an example, if you find me as a field trainer, you will see me as a very strict trainer. I'm very strict when you are coming for internships. I'm very strict. I'm not kind like this. I'm more kind when I'm with my patients, right? With my clients. So we have, we can change our personalities. We can switch from one brain to another. And with my loved ones, I'm more kind, my loved ones. So that's why the brain can change your mood, your personality, your thinking pattern. We call it the split brain. Although we have one brain, actually it can work in different ways. See?
So the brain is, although it's been compact inside your skull, it's been, squeezed. The brain has squeezed itself inside. That's why you get this wormy appearance. It has a very big, large surface. It's very large, very huge. So it should facilitate trillions of neurons inside it. So that's the central part of the brain. We call it the cerebral cortex, the gray matter and the white matter. So white matter are the cell bodies, gray matter, are the axons, the tails, gray matter are the cell bodies. Can you remember those? So the cell bodies are situated in the gray part of the brain. There are two colored areas you can see in a brain. Just Google human brain and see some images for a better understanding. I don't expect you just to know about these things, to know about the human brain. It's nice. It's good to know about your brain. Talking about the peripheral nervous system, we are having the autonomic and the somatic nervous system. Somatic nervous system which controls our digestion, your heartbeat, your breathing. That's the somatic nervous system. It's involuntary. The voluntary movements. The voluntary movements. Voluntary nervous system. And the involuntary nervous system is our autonomic nervous system. So it's having this internal regulation. So it's reactive. It prepares our body to react to a threat. The sympathetic is the arousing part, sympathetic nervous system. The parasympathetic is the opposite of that. It's the most relaxing part. For an example, when you are facing a threat, there was a recently I saw in the news, there was a tiger broken into a house while it was hunting on a dog, domestic dog. The tiger had jumped inside the house, and luckily the people had escaped. And the tiger was catched and released to the jungle again. So just imagine suddenly a tiger breaks into your room. What's your reaction? You can't just, think, yes, a tiger has come. Now what I should do? What's the better? No, your brain is not working like that. Your nervous system helps you to keep alive, stay alive. Idiot, run. The nervous system sends you to run, right? It directs you to run. The autonomous nervous system, the automatic nervous system activates and prepares you for the threat. It increases your heart rate, heartbeat. Your blood is being pumped. All the blood from the internal organs are being pumped into your muscles, to run or to attack. So your pupils are, dilated to find good, to see properly. So there are changes happening inside your organism. There are so many changes happening. So your glucose has been, glycogen is break down and glucose levels giving you energy. Other stress hormones, cortisol, adrenaline is helping you to work, to act immediately, giving you all the energy to face the threat. You will not feel hunger. You will feel energetic. Right? Your coordination increases. Have you seen when tsunami came, women had climbed coconut trees? It's for the help of your sympathetic nervous system. Parasympathetic is the other way around. It helps you to eat well, rest well. It's the opposite. It calms you down. So you can just see about this. Different functions of different nervous system. So just imagine when you're scared, your sympathetic, it's a threat, right? When you're scared, it's a threat. So your sympathetic nervous system activates and prepares you to the threat. Can you remember? Your mouth gets dried out. Your pupils widen to see very clearly, to get more information. Heart rate increases. You're getting rapid breathing. Your digestion slow down. It's not time to digest things. You should concentrate on running. The sexual activity, the both systems are activated. It's in the climax when you're aroused, superiorly aroused. Climax, orgasm, then the sympathetic involves. But what makes you aroused is your parasympathetic nervous system. That's why to have better sex, you should be in a relaxed mood. When you are tense, you cannot have good sex. Right? Sweating increases, having the grease, sending the heat out of your body, cooling your body. That's why you're getting sweating. So and so, right, guys? Right? How the nervous system inside? These are not under our control, but the higher functions can control this if it is unnecessary. For an example, in phobic anxiety disorder, the patient gets unnecessarily aroused. So through relaxation techniques, through CBT, through other cognitive therapies, we introduce relaxation or cognitive reappraisal to redefine the threatful situation as non-threatful, to understand the physical sensations and to not to continue on those, not to concentrate on those. If you concentrate on the stress reaction, you will be more stressed. If you feel your heart is beating fast, you will be more stressed. You will be feeling like you're going to die. That originates panic attacks. I don't know whether you have gone through panic attacks, right? What else rather than the nervous system helps regulate our thoughts, our minds? Are the system called, we have the endocrine system. Even the animals are having the endocrine system. So except for neurological impulses, except for this nervous system, there is another system, there's another chemical system that directly involves in our mind, to our thoughts. It's the endocrine system. Hormones. Hormones, have you heard hormones? We have separate hormones. For an example, the pituitary gland, it secretes prolactin, a hormone, a chemical. So when the mother for the first time sees the child and hears the child cry out for the mother, the brain understands that the mother is the only source for food, nutrition for the baby. If the mother is not going to feed the baby will die within a couple of minutes. So the pituitary gland releases prolactin and it secretes milk from the mother. So the compassion, love, affection is being generated. Thoughts of love, care, motherhood is being understood with the help of the endocrine system. Boys are becoming men, girls are becoming women, ladies due to the endocrine system. We fall in love due to the endocrine system. We may do sex due to the endocrine system. We have babies due to the endocrine system. Our body is functioning, our energy is also being supplied by the endocrine system. For an example, thyroid hormone, it's like the engine oil in the body. When you have less amount of thyroxine in your body, you go slow, you will get depressive symptoms, your thoughts are being slowed. So these are the slow chemical communication system of the body. They are not quick. It takes time. It takes to mature, but still it works. The endocrine system. So it's not wrong. That's why when you have getting clients to you, you have to think about this. Is this a hormonal problem? Better I should send to a psychiatrist, better to another medical doctor if psychiatrist is not in the vicinity. The depressive symptoms, can it be due to the thyroid problem? A girl with a swelling in the neck comes with you with depressive symptoms. This could be a hormonal problem. Please go and see your doctor. Show him, tell him about these symptoms. He will think about hypothyroidism and treat you with thyroxine. Or you're anxious. You're having high levels of adrenaline or cortisol. Sometimes some medications will help you. We have some medications like propranolol. We can control the heart rate and stop the negative feedback loop that comes back to you and increase the anxiety more. We can give sedatives, anxiolytics. We can chemically mediate, chemically control. That's why you should always liaise with a doctor and get the help of the chemical management to help your client to get well soon, to rectify the medical problems. It's not just experiences, thoughts that influence. It's also the internal chemical environment of the body, the atmosphere of the body, the balance of the body also causes disturbances in the human mind, causing mental health problems. Some people are aggressive and agitated due to a chronic migrainous headache, or it could be piles. He's bleeding while he's, excreting. He's having a problem. He's having a physical problem. So don't waste your time applying, anger management concepts. Just tell the guy to go to a doctor, see a surgeon, and get the pile cut off. Do the surgery or any kind of surgical intervention to solve the problem. Rather than don't teach him, don't waste time teaching him, anger control methods. No use. That's why a counselor should have a broad vision, a broad base of knowledge of mental health problems, can have medical background also. So don't forget it throughout your career. Whether you are going to be a counselor or a housewife, or you will be collecting another certificate for your qualifications, whatever it is, it will be very necessary information to your life, even in your personal life. People are not sensitive for this, so you should be very sensitive. So this is what I call, these are scientific methods, these are reality, these are true, these are not just theories. So this is an electroencephalogram, the EEG. We can measure the electrical activity, whether it's normal, abnormal, whether some part there is a wrong, whether all the areas of the brain is functioning, or in a specific area there is some part of the brain that is malfunctioning. So this is another proof that we are having electrical activity, because electroencephalogram records electrical activity, and it's been displayed to us in an understandable manner. And this is what I was talking about. CT, we have functional CTs. We have functional PET scans. So you inject something into your bloodstream, a chemical, and while the thought process, while the person is thinking, those chemicals are being, collected, gathered in the specific areas of the brain. And we have identified in such manner, this specific area of the brain is related to this function. So when the person is seeing something, the occipital lobe is functioning. The chemicals are being accumulated there. So we can see it, we can test this. This is the fMRI. So we can see in the red color. It's just not magnetic resonance, it's functional magnetic. So in a living thing, we can see the dynamics, fMRI. Okay, we are coming to the latter part of the discussion, the last part. What else do you know about? What else you should know about biopsychology? Bio. Just imagine who you are now. What made you the person that you are today? What is your first answer? Someone speak. What made you the person who you are today? Can someone give me a very knowledgeable answer? Wasima, I would like to hear from you. What made you who you are today?
Our genes.
Yes. Is it only genes?
Social experiences and background influence.
Yes, it's very good.
Socialization.
Sir,
Yes.
I think everything, both physical and biological, as well as social experience and everything.
Yes. All the answers are correct. It's like this, guys. Right? We call it, simply we call it nature and nurture. Nature is the genes. Who we are today is the product of our genome. Genome is the genes. We get 50% of our genes from our father, 50% of our genes from our mother. But how does a person looks more like the mother or more like the father if we get 50% each? It's due to our genes. It's due to our genes. It's due to our genes are having two qualities. One is a dominant. We have dominant genes. We have non-dominant genes. If your father's genes are more dominant, you will get more fatheristic features of your father. If your mother's genes are more dominant, again, you will be like your mother. So what makes a gene dominant or non-dominant? It's our same repetition, our genetic pool. That's how your father got the genes from your grandparents. How did your grandparents get the genes from their great grandparents? It goes like that. So it's not just the genes that have created you. It's the way you were brought up. Your early childhood experiences, your attachment with your parents, your other siblings, your school, your colleagues, your love, your children, everything is being influencing, and those everything is being coded in your genetical material. That's why usually when you are a teacher, your children also tend to become teachers. If you are an engineer, your children also tend to become engineers. So this is two-way process. The external environment influences in us, and our internal environment influences in the external environment. If my father is an addict, I have a great tendency to get an addiction. If my mother had extramarital affairs, I have a tendency to have extramarital affairs. Yes, that's the truth. So it's an two-way process. The internal environment influence the external, and the external influence the internal. So there are some diseases that are genetic. Even schizophrenia has a clear genetic relationship. Even depression is also having a genetic component. There's an influence. You see in families of suicide, you see suicidal families, and you see the brother committed suicide, then the sister committed suicide. The uncle, the aunt committed suicide. It's in the genes, guys. So always remember in your history to inquire about the family history. To understand the genetical pools the patient is having other mental illnesses, neurological disorders. Usually our people will not speak. If you directly ask, do you have mental disorders in your family? Usually people are not happy to answer that question. Sometimes the question is too direct, so harsh. So what you do, you can ask the question laterally or indirectly. Have you ever heard about people, in your family? Are you known to some people in your family who had some neurological problems? That word is more soft. Snayuabad. Or any people who committed suicide, unfortunately, who were deserted, living alone, isolated. It directs us. It tells us that there is a genetical tendency towards a mental illness. When the mental problem is genetically backed, when you're having a genetical background to your problem, guys, Always remember, again, you will not be able to handle the problem alone. It's always good to share the burden with a medical doctor, with a psychiatrist, because genetical disturbances are rarely correctable. It's almost practically not correctable. So we could apply some other interventions to ease the burden, but definitely, practically not to solve it. You cannot solve through psychological intervention. For an example, learning disability, Down syndrome, Alzheimer's, anything, any disease can be eased the burden through therapeutic interventions, but not to solve it completely. Hope you understood. So the nature or the nurture, what comes first, what is more important, it's still a debate. But we know one thing for sure, they both contribute. They both contribute to the human behavior. So we can code it, we can identify this gene cause schizophrenia, this gene, if you are having this gene, it will cause depression or anxiety. So every illness, almost every illness is having a genetical explanation, which again backs the biological basis of mental health problems, which again emphasizes of the importance of medical involvement in treating, in handling these cases, guys. Understood what's the point, the realistic point that I'm trying to highlight? That you should remember throughout your career, not to get failed by handling unnecessary burden. Always share your burden with medical doctors. Right? About into inheritance, there is enough evidence even in your family. The way you talk, the way you yawn, the way you behave, the way you sleep is like, directly influenced by your genetical background. Sometimes you speak like your father, you sleep like your mother. Well, people even say you walk like your parents, you talk like your parents. It's called the inheritance. So sometimes if the father is aggressive, the child will be aggressive genetically, right? So it can be also a learned experience. So the problem is a little bit complicated. We will understand the gravity of the problem. And there are illnesses that are genetically transmitted. We have genetical background for hypertension, diabetes. So we can give explanations to the people, right? This is not your fault. These are your genes. We can project out the guilt of patients. Sometimes people will be shouting at the children for not having a good results in the class. But unfortunately, the child's IQ is below average. And even the parents' IQs are below average, which shows a direct genetical correlation. And we can explain to the parents that these are your genes that are in the child. Do not expect something above, something beyond your capacities from the child, because this is your child. This is your production. The child is having, unfortunately, your genes. So control yourself. Have minimum expectations, please. Only why we need this knowledge about biopsychology when it comes to therapy, when it comes to counseling in psychoeducation. So the basic component in the nervous system is the neuronal cell. In our genes is the DNA. It's a protein spiral. There are two twists. So the genetic information is coded here. So it's for your extra knowledge. So about DNA, something, we have, when few DNAs are collected together, we call it chromosomes, collection of DNA. There are chromosomal illnesses, right? There are genetical illnesses depending on these chromosomes. Okay? The chromosomes. We have identified pairs of chromosomes. We have 22 plus our sex chromosomes. So all the chromosomes are paired. Can you see? 22 chromosomes are paired, couple in here. Except for the sex chromosome. Either we have X, either we have Y. So with our other partner, if two X's. So you get one X from one partner, other X from another partner, you will get a girl. You get Y from the husband, X from the mother. The mother females are having XX. Only the males are having XY. So it's not the mother's fault if continuously daughters are delivered, it's the father's fault. The father is continuously giving only X chromosomes. So mother is having only X, so two X's gives a girl. The father should give a Y chromosome. So fathers usually tend to accuse the female, like mata me sare duek tunne, you didn't give me a daughter. But we have to teach the daughters, we have to teach the wives that it's the man should give, and we should teach the man it's your sperm is and only having X, your Y sperm is fading, so it's your fault. It's not his fault, just to correct his cognition, just to stop accusing the wife between X and Y. So you see identical twins when one sperm cell goes into one ova, one egg cell, and it divides into two, and that two is separately starting divided. You get identical twins. When one egg or ova at once two sperms are being entered, you get non-identical twins. So we have come to the end of a very valuable topic in your counseling life. You should understand that we are controlled by our brain. And if we feed the brain with proper information, it will control us properly. Right? And our behaviors change the brain, and the brain influences the behaviors. So we can influence the brain. Whether it is being controlling us, we can influence the brain. We can teach correct things. We can correct the way we think. We can correct the way we behave. Right? That's what therapy is all about. So doctors are having drugs as treatment. Counselors are having words as treatment. So through words, we influence in the human mind, we make changes, we reconstruct cognitions, we change behaviors, we alter them into a very fruitful, effectful, mentally stable manner. That's the end of today's lecture. Any questions, ladies and gentlemen? Any questions?